And welcome back to Smiles by Mary. I'm Pat Dewar. The host of the show is Dr. Mary Swift. She's the 2011, 2012, 2013 Consumer Choice Award winner, and most recently nominated by Angie's List with the Super Service Award. So we're talking about Invisalign. We're talking about what it's done for people in clients of yours. I'd love to know, are there any other benefits that you see in doing Invisalign?
One that we haven't talked about yet is something that in dentistry it's very current and timely to be looking at airways.
Looking at airways.
Okay, follow me on this. The size of the air passage that you have is important during sleep, okay? We want to get as much air as we can. You've probably know somebody that's on a CPAP or a snore guard or some appliance to help them breathe better at night when you sleep.
My wife just wants to stuff a sock in my face, but...
Think about this. With Invisalign, we can open up airways.
Oh, really?
Literally, if you have a constricted arch, a narrow-shaped, horseshoe-shaped arch, and we can expand that arch, we can get you more air at night.
Oh, so what you're saying is actually in the U of
in the back of the throat's expanding,
and you're using Invisalign to do that?
For air, yes.
How are they doing that? I mean, I'm really curious.
Expanding the arch, opening up the arch, which opens up the available airspace. So that's just one example of improving your overall health with Invisalign to open up an airway. Alignment is important for spine health. TMJ, some patients, you might have heard of TMJ. It has to do with this jaw joint. And some patients suffer horribly with TMJ. It's actually TMD, the dysfunction of that joint. And that happens because of missing teeth, misaligned teeth, and you can correct that with Invisalign. You can get better alignment, which gets that joint healthy, which helps with migraine sufferers, clenchers and grinders. We talked about airway. We talked about gum and bone disease. Improving your overall health.
I'm amazed because I know that even my wife had, they literally went in and broke a hand that at one point and reset it. And I wonder if Invisalign could have been one of those things. They didn't have it back then, but you wonder if that could be helpful.
You wonder. Invisalign has been around for about 15, maybe even 20 years now, and was originally designed for just simple issues, simple crowding or closing spaces. It's gotten much more advanced with research and development and product development. So it started out simple, but it's now a very important part of my practice, that's for sure.
So these little trays, they're going for, you said 2 weeks, so they're coming back quite frequently, or what do you do?
Thank you for bringing that up, Patrick. No, we monitor each case about every 6 weeks. We give the patient 3 trays. And they wear each tray for 2 weeks. They come back in. When I start an Invisalign case, I have the finished product on the computer. In other words, I straighten the patient's teeth digitally on the computer and set a button when I see what I like, and then I monitor the case and make sure the computer and the patient are following along and things are progressing the way they should. So we give the trays out every 3 or 4 at a time.
Really? Now, one of the other things is the importance of the standard that you use. I understand there's a dimensionality that you're trying to reach for.
Well, we're one of the few practices in North Texas that digitally scans the patient's mouth as opposed to taking an impression. You've all been at the dentist and had them, fill a tray with a putty and put it in your mouth and, time it, and we no longer. We have a digital scanner that makes a computer image, which is way more accurate than the impressions, and so the outcome it's a better outcome, better fit trays, more predictable outcome for the patient.
Then isn't there some sort of, I don't know if it's called a Da Vinci type of standard that you've used for actually aligning and creating the perfect smile?
When we're talking about teeth, yes, and porcelain and improving an aesthetic smile, there are dimensional rules by far. You literally look at the patient's face, divide it into thirds, you look equally. Our eye likes symmetry. And so every aspect of improving a patient's smile has to do with how well it fits in their face. One of the biggest mistakes I see with some of the dentistry out there is it's a little disproportionate to the face, and somebody didn't consider all of those measurements.
Yeah.
Yeah. You've seen it too.
Well, I'm sitting there thinking of things that look like chiclets in your
Yeah,
mouth, and you're like,
yeah.
oh, that didn't look real good, but
Yes.
somebody persuaded
I
you.
love dentistry. It's a combination of science, art, math, beauty, all of that to put a perfect smile.
Well, and you're such an artist in what you do, and one of the things that I know, and in order for you to have created what you've been able to create, it had to have been the standards that you've run and the systems that you use for the last several years. And Smiles by Mary is really kind of an educational tool for current clients and future clients. One of the things we want you to do is listen to these shows, learn about different applications that you might be able to use in your life. We've got one more segment coming up. Smiles by Mary. We'll be right back.
Staying involved in dentistry on every level, local, state, and national, makes me a better dentist. Our patients are our life and our livelihood, and we appreciate every single patient that walks in that door. And these are our family, and we treat them that way.